At Walt Disney World in Florida, NBA players have begun arriving with dreams of winning a championship ring. But as the season officially restarts, many will be wearing a different ring, a titanium smart ring called Aura. It's designed to monitor sleep, pulse, and temperature, but it may be able to do more. A Finnish user posted that his Aura ring's readiness score was unusually low, spurring him to get tested and discover he had COVID-19. Using the Aura Ring, researchers at West Virginia University developed a digital platform that detects COVID-19 related symptoms up to 3 days before they show up and with 90% accuracy. Other universities in San Francisco and San Diego are conducting coronavirus studies with Aura too.
But if you look at their, studies, so-called, they're very careful to say at the end of each of them the caveat, which I will read. Aura Ring products and services are not medical devices and are not intended to mitigate, prevent, treat, cure, or diagnose any disease or condition. If you have any concerns about your health, please consult your doctor.
Van Reenen says that's an indication Aura is not taking responsibility for what they claim their product can do, but he does welcome any tools that might help contain COVID-19.
We're all trying to find different ways to make this current situation a little more palpable. And if there's anything that it can do, like various other Apple Watches and ways in which technology is trying to help, then great. But I think that really there needs to be a lot more research.
The challenge right now is you can't tell the difference between what's happening with COVID-19 or if it's the regular influenza, right? And that's one of the biggest challenges with the Aura Ring. However, that monitoring is useful and that performance data over time is going to be useful, but we're going to need other things such as temperature screening. You're going to have to do 1-hour tests. You're going to have to do other types of methods to be able to figure out what is happening in the arena, in the environment.
As it's a tracking device, NBA players will not be required to wear the rings. They have a choice to opt in.
A lot of players have these rings. These rings are a couple $100s each. You can even go for the diamond version for $1,000. Right. The point being is, can we use this for frontline workers? I think a lot of the data that's being collected with the sports can be used for other uses, and I think that will drive down the price points over time. We've got to get this down to a point where whether it's thermoscanning, whether it's a wearable device, whether it's testing, that we can do it at scale and affordability so that everyone else can use it.
Aura isn't the only wearable being used to research COVID-19 applications. The Scripps Research Translational Institute and Stanford Medicine are all using devices like Apple Watches and Fitbit trackers to detect the early onset of COVID-19 and the flu. But all eyes will be on the high-stakes, real-life experiment happening on July 30th, the return of the NBA season. Mark New, CGTN, Sunnyvale, California.